As plans for a return to organized sports began and over 10 million high school and college athletes emerged from this unprecedented period with limited training and conditioning, we're talking to HMG family medicine and sports medicine physician Dr. Kevin Metzger about how to keep your athletes safe this fall sports season. Welcome, Dr. Metzger.
Thanks for having me.
Yeah, let's talk about this because this year has certainly been challenging for athletes, especially
Sure.
going into this fall season, especially for football players.
Absolutely. I mean, everybody's had changes in their life because of this, and athletes are no exception. A lot of people have spring sports they can't play, and then their spring training has really not happened. And so we really wanted to bring up the topic of getting back to sport. And so that's really what I want to talk about today.
And, as we go in, have you got some recommendations for those athletes, for those trainers, even for the parents that are involved? Have you got some recommendations on how to keep their athletes safe this fall?
Sure, absolutely. So there's a couple things that we're watching out for and seeing. One is getting back to sport injuries. And so kids that aren't in shape and sport ready. Two is heat-related injuries, and three is really unique things from COVID positive patients. And so the Sports Medicine Society, American College of Sports Medicine, all actually put out some guidelines about how to get back to sports safely. And they put those out for coaches as well as athletic trainers and ADs to be able to help kids back to sports. Most of these injuries from overuse are lower extremity injuries. And so there's some activities they can do in their warm-up routine that can help prevent these injuries from happening.
And you talk about preventative training programs. Can you go into that a little bit more? Give us some detail on what that entails.
Yeah, absolutely. So some of these have been studied for a pretty long time, including some ACL, which is the most common knee injury prevention programs. Most of these are incorporated into the warm-up component of practice, about 10 to 15 minutes each, and really only has to be done about 2 to 3 times a week to be effective. These include plyometrics, which is kind of quick movements, jump training, flexibility, strength activities, and most of these are laid out pretty easily in these recommendations that coaches and strength coaches can follow.
Is there anything that, I mentioned parents a moment ago, is there anything specifically that parents can do to make sure that their athlete is getting the warm-ups, the things that they need to play safely this fall?
Sure. I think the most important thing in this COVID era is if an athlete has tested positive for COVID, they need to see their own physician for clearance prior to play. As we're learning new things about this coronavirus, there are some special heart conditions that we're seeing that might be associated with. And so seeing someone especially trained in your primary care doctor about getting back to sport. The other thing that's really helpful is making sure they have their own water bottle, if not already provided. With the current recommendations from the Tennessee Athletic Association, they're recommending everyone have their own water bottle to prevent any spread of coronavirus. As well, making sure your athletes are in shape prior to season. If they're not going back right now, try to get into running routine right now before they get back into sport. Get off the couch a little bit so that when they get back to it, they won't have as many injuries.
And that takes care of the home side of things, but they're at school. What can coaches, administrators, trainers do? Have you got some recommendations for them as well?
Absolutely. So the big thing is just everybody is coordinating this well. And so I think it starts from the athletic directors and just making sure everyone's on the same page. First, making sure the local guidelines are followed to reduce the risk of coronavirus. And then if they're able to actually play, making sure the kids are in shape as well. And so things have already happened, but we continue to recommend heat acclimation. And so there are guidelines put out by the Tennessee Athletic Association to make sure that happens. So a few days of no pads prior to hitting. And then again, making sure they have their own water bottles, that they take breaks as needed, as it's hot right now, so they don't get any heat injuries. And then the coaches, watching out for your kids. You're going to know them best. So if they look like they're injured, have your trainer or the physician you're working with evaluate them.
All right, Dr. Metzger, we appreciate the time. Great information. I mean, it's been in the news, it's been in the forefront. Everybody going back and playing high school ball and playing a college ball. This is timely information. Thank you.
Well, thanks for having me.
All right, Dr. Kevin Metzger there with Holston Medical Group. And if you need more information, you can go to holstonmedicalgroup.com for more information.